The doctor is in.
Since 1886, when Dr. Reginald Fitz first described it, appendicitis continues to be a common emergency condition around the world. Welcome to Doc Talk. Today we will take a look at what the appendix is, how appendicitis pain develops, and its surgical treatment. Analyzing the occurrence of appendicitis over the past century, the epidemiological patterns of appendicitis show that it is somehow triggered by the industrialization of society. The incidence has climbed, declined, and then plateaued in Western countries, but newly industrialized countries appear to be in the first stage of this graph. So, what is it? The appendix is a thin tube about 4 inches long that sits at the junction of the small intestine and the large intestine. Normally, the appendix sits in the lower right of the abdomen. The function of the appendix is not fully understood. One theory gaining momentum is that the appendix acts as an emergency storage for good bacteria, which play a part in rebooting the digestive system after diarrheal illnesses. Normally, in the intestines, there are plenty of good bacteria known as commensals or sometimes probiotics. They are essential for a healthy living. You can see how the gut is cleared of normal good bacteria after a bout of diarrheal infection, and the appendix is believed to repopulate the rest of the intestines from its reserves of commensals. Previously, the appendix was thought to be just a vestigial remnant from our evolutionary past. Surgical removal of the appendix causes no observable illness. It's not clear what causes appendicitis itself, but in many cases, it may be a block at the entrance of the appendix, caused by a small piece of digested food or a swollen lymph node within the wall of the intestine. Appendicitis can be a challenge to diagnose unless the typical symptoms are present. While the diagnosis is in question, antibiotics treat any potential infection that might be causing the symptoms. To reiterate, antibiotics alone cannot effectively treat appendicitis. If the symptoms are not typical, further tests may be needed to confirm the diagnosis and to rule out other conditions such as gastroenteritis, severe irritable bowel syndrome, constipation, and urinary tract infections. Thank you for watching Doc Talk. Please like and subscribe. I am Dr. Akhilesh.